Okay, this is marking the cornea along the astigmatism axis. We use a little marker device, and then that axis right there is where your astigmatism is along that degree. And then in the end, I'll line up the toric lens along that axis too. So I make a tiny little incision into the front of the eye, and here I'm putting some clear jelly. Actually, that's some anesthetic. And then next I'll put some clear jelly into the eye, and that clear jelly kind of stays in there and helps to keep the eye pressurized while I'm working. I'm making the main incision into the eye with a sapphire blade. It's 2.4 millimeters in size. You can see some of that jelly burp out of the eye then. Now I'm going to open up the front of the cataract. This is called the capsule rhexis, and we peel open the very front part of the cataract's capsule. And this is probably one of the most tedious parts of the procedure right there, because that capsule's so thin and you don't want it to tear in the wrong direction. So it makes a perfectly circular opening. Then I inject some fluid underneath the capsule, and that separates the cataract from the capsule itself. And now I'm going to use the little ultrasound tip that kind of dissolves and sucks out the cataract at the same time. Some of this video I put on 3x speed, but this is right here, this is being played at normal speed, so this is exactly the speed at which I'm operating. Your cataract is fairly soft. It's not a super dense or rock hard cataract, so it's pretty easy to remove. So there I've divided the cataract into one part and now another part. And I'll just slowly start kind of removing those parts, and they come out in chunks, and then the little ultrasound tip will kind of dissolve it and suck out the chunks, and I just work my way all the way around. I'm spinning the cataract around because I've loosened it from the capsule, and so the capsule is completely intact while the cataract just moves around inside the capsule. And so here's a fairly large chunk that's going to come up and get removed. And it's just really critical at this point to get the cataract out, but also to preserve the capsule, because the new lens fits inside the capsule. The capsule acts like a bag that holds the new lens into place. So that's why the capsule is so important. The back of the capsule is what will eventually become a little bit cloudy, and then we'll use a laser to polish off the back of that capsule when the time is right. There I'm using some clear fluid just to remove any remaining cataract. This is just the very outer shell of the cataract called the cortex, and here I'm using just a device that has fluid and suction only. This cortex is really soft, and you just kind of strip it off the walls of the capsule bag. And the view that you're seeing is in 2-dimension, but when I operate I'm using a 3-dimensional microscope, so I have, everything's in 3-dimension or depth. But what you're seeing is just a 2-dimensional output, so it's a totally different view from what I have. And that's the new lens going in right there. So it kind of goes in through a little injector, and then it comes into the eye. It's folded up, and then as the injector releases it, the lens starts to unfold slowly. And here I'm going to use another little handheld device that's going to kind of help the lens to unfold a little bit more. And while it's doing that, I'll use that same device to, you can see the little arms that went out there, and those arms kind of reach out and lock it into the capsular bag. And then this device right here is just polishing underneath the capsular bag. I'm trying to remove any little microscopic cells, cataract cells that are still living there. And when you remove those cells, it just helps things to heal even quicker. So I'll go along the other 180-degree sector of the capsular bag and just polish it off too. And now I'm going to, now that the lens is in the eye, I'll remove the jelly and just go around and check to make sure that no little pieces of cataract are still there. Sometimes a little piece can hide out somewhere, and this will ensure that you get it all out. And now I'm going to rotate the lens into position. If you look closely at the very edge of the lens, there's 2 little hash marks, and I'm going to rotate the lens around to make sure that its arms are fully opened and that it's positioned well, but then I'll keep rotating the lens until those little hash marks are lined up with the blue hash marks that I placed on the cornea. And once the lens is lined up in the right position, then that means I've got the toric lens rotated to the correct axis. So I'm just really tiny little steps here to make sure the lens is perfect. And although you may not appreciate from your view that the lens is perfectly in position, that's just because your eye's kind of moving around a little bit. But I do little things that I can see that I know the lens is perfectly positioned. There I'm injecting some fluid into the incision, and that causes the incision to seal up on its own. I had you reposition your head there a little bit. And then I'm going to put some antibiotic into the other tiny little wound, and then check it with some little micro sponges to make sure there's no leaking, which it's not. And now I'm going to inject some steroid, and the tension of the eye is good. Now I'm going to inject some steroid that will stay with you for several weeks and help to keep you off of having to use a bunch of other eye drops as well. So I hope you enjoyed watching that, and have a Merry Christmas.